The Compassion Clinic is a mobile, longitudinal, University of Louisville student-run initiative whose goals are to provide basic health screenings and education to disparate populations in Metro Louisville. The clinic is housed in the Office of Diversity and Inclusion and requires the help of students and faculty across the Health Science Center campus. The Compassion Clinic mobile locations and target disease screenings and education are guided by the information provided in the 2017 Louisville Metro Health Equity Report. The report demonstrates a decreased life expectancy in West Louisville as well as an increased rate of death due to all-cause. The first year of the Compassion Clinic provided care to 723 community individuals with the help of 257 volunteers at 6 clinic sites. The Compassion Clinic allocated resources to provide screenings on education, on heart disease, diabetes, cancer, drugs, alcohol, tobacco, and mental health. Screenings included lipid screens, blood pressure screens, BMI, hearing and dental consults, as well as cardiovascular risk assessments and vascular ultrasounds. Volunteer effort across the Health Science Center campus includes volunteers from the medical school, dental school, nursing school, School of Audiology, School of Pharmacy, as well as across campus as we recruited the help of physical therapy at Bellarmine University. Our community partners include the Environment Institute, Louisville Fire Department, Police Department, EMS, Get Healthy Now, Feed the West, and many more. The Compassion Clinic responded to the COVID-19 pandemic by changing from an on-site mobile clinic to an online virtual platform in an effort to remain engaged and offer a positive medical presence in our community. The Compassion Clinic built a website to provide information on clinic events and volunteer involvement, and a YouTube channel to host educational videos on chronic disease. The clinic also hosted the university's first ever virtual open fair. The fair had 2 primary components. One was a pre-recorded video montage of 10-minute educational videos on the most common chronic disease that individuals could watch online or use a toll-free number to call in and listen to an audio broadcast. In addition, individuals could call 10 different phone lines to speak to medical professionals and ask questions and referrals to resources. These phone lines included Ask the Medical Doctor, Ask the Nurse, Ask the Ophthalmologist, Ask the Audiologist, Ask the Mental Health Provider, and Ask the Dentist. Our pre-recorded health educational videos provided information on hypertension and blood pressure, obstructive sleep apnea, diabetes, nutrition, telemedicine, tobacco use, skin exams, mental illness, dental hygiene, hearing screens, HIV, COVID, vaping and smoking, immunizations, Kentucky Children's Medicaid Program, and the census. Data collection at clinical sites is critical to guide the decision-making process of future clinics. Working with the School of Public Health, we created a survey to identify patient demographics, census information, household income, level of education, health insurance, and access to technology. The Compassion Clinic created an online medical presence in response to COVID-19. This allows us to continue our mission to provide positive medical care to the underserved populations in Metro Louisville. In conclusion, participation in the Compassion Clinic and affiliated Office of Diversity and Inclusion provides opportunities for increased awareness of challenges to patient care medical adherence impacted by poverty, education, and community resources. What do volunteers gain from participation? Volunteers have an opportunity to engage with patients in their own neighborhoods to better understand the barriers in healthcare and discrepancies in life expectancy rates and all-cause death. They also have an opportunity to communicate and provide procedural skills without time constraints while learning in their academic careers. What is the benefit to the community? Health screenings, education, and linkage to a medical home, opportunities to ask questions, and opportunities to build positive relationships with a new generation of medical providers. The Compassion Clinic has reacted in response to the COVID-19 and will continue efforts to reduce burdens in healthcare by providing care to our community virtually and assessing where to go in our next steps.